Middle Maps is brought to you by Arukah Well. Arukah Well is a functional health service providing personalized coaching through a virtual platform. To learn more, check out arukahwell.co. That's ARUKAHWELL.co. Welcome back to Middle Maps. As always, I hope this finds you well no matter what season of life that you're in. Today I have a really incredible episode. I'm traveling around Costa Rica, and while we've been here, I've got to meet Chor and Miss Elizabeth Bast and here at Soul Centro, and just the work that you guys are doing is so incredible. Thank you for having us and allowing us to be here.
Mm-hmm. Thank you.
So I know the time is important to all the listeners, so we'll just kind of jump in. There's a lot of different information out there about the different works that are occurring in some call it alternative medicine, more holistic medicine, but it's not using what we call like Western medicine. And so you guys use a specific kind of medicine. Could you tell us like what that medicine is, what that looks like, that kind of thing?
Mm-hmm.
Sure. Go. We here serve Iboga, which is a sacred plant medicine from Africa. It is a visionary medicine. It is a soul medicine. It is a mind medicine, and very much psychoactive. I've heard it affectionately described by one guest as 100 ayahuasca ceremonies in a night. Is a very good way to describe it. It is the most powerful physical detox on planet Earth. And as we now know through Western science catching up with indigenous science, that its healing potential is profound. It can actually take people off of physical dependence of opioids in as little as 24 hours or one treatment, depending on what's happening. Sometimes 48 hours and sometimes people need another treatment. But it can disrupt that addiction while mitigating withdrawals. And it's also, as we now know through a study at Stanford, that it has profound effects for healing traumatic brain injury. And we're seeing wonderful results with PTSD. And we're very blessed. We learned through indigenous teachers. They have had a very deep devotional relationship of study with this medicine and a reciprocal relationship. Every relationship is better with reciprocity, right? Giving and receiving for eons and eons. I mean, we're tapping into a lineage that probably has held this medicine over 1 million years. Yes, through what we know in the origin stories is what I sense, if not longer. And we're very blessed to hold and be the recipients of that level of intimacy with this plant. It's an honor to be here with you today to share about it. Yeah. It's also a very medically sensitive medicine, which we will speak about.
Yeah, excellent.
We work with the plant medicine, Maboga, Deboga, with those are original context, original names for the medicine, and Iboga is one of the original traditional terminologies or terms for the medicine. It's a medicinal sacrament from the Bwiti tradition, and we work with the Misoko Asangwidia branch, and they pretty much provide the traditional protections for working with this medicine. This medicine is a very serious medicine to work with. It's not like popping some aspirin. They from your medicine cabinet. No, this is a medicine that's gonna heal or help you heal yourself when it comes to your mind, body, and soul. And there's many different aspects of working with the tradition and working and going down that path with the tradition to really help people heal themselves. Yes. If people actually really heal.
I want to come back to that too. You guys have said so much awesome content just to kind of jump in. I think first, especially in Western culture, when we think of psychedelics, I mean, if you're over the age of 30, you immediately think of Tim Leary and all the work that was done there and LSD, and then, you kind of see it used as a party drug and just different experiences. Now we're starting to see it more back in the medicinal world where it started originally. What about this herb or this plant is different than some of those others, maybe the ayahuasca or the psilocybin or the psychedelic mushrooms, those other compounds?
Sure. I love this question. Thank you. The Bwiti and the original holders of the medicine, the Babongo, who are also referred to as the pygmies in colonial terms, and that's the second oldest genetic line in the world, is a Babongo. So that's a very
could be
the oldest, according we could be very very old, essentially. That's a long time there, and I see a few things. So one, they call it the godfather of all plants. And this is the plant that knows all the plants. And what we often hear, I heard it just yesterday, I hear it all the time, someone will say, I was in an ayahuasca ceremony and Iboga came in. I was in a peyote ceremony and Iboga came in. Like, this is a medicine that actually has the potential to hijack the line of all the medicines. And I see it as the most far-reaching, most far-knowing medicine of all of the plants on Earth. It is an ancestor. It has, and as the origin story goes, it has been watching human beings for a very long time. And in the origin story, it said, as it introduced itself as a spirit to the first person who intentionally received the medicine, that it has come to answer our questions. And I see that it bioengineered itself to help us with our complex burdened minds, as Chor says. And I see that it is a plant of prophecy in the sense that nothing is written in stone. We have a playing field of a lot of moving parts that is governed by choice. And I see that it could see where we were going because it helps people to see where they're going. And I see that it came to really help us, and at a critical time in our development as a species. And it's very possible we co-evolved for the 1.7 years that we've been using fire or something. So it knows us very well. It probably helped shape our brains. The whole stoned ape theory, I think this is one of the originals, really, of the human beings coming out of Africa. I know everybody came out of Africa. It is one plant versus two, which is interesting. Like, ayahuasca is two plants. And it's just interesting to note that. And for me, it is the ultimate mind medicine. All the medicines help us with our relationship to our mind and body and soul, but this truly is the ultimate mind medicine, the ultimate soul medicine, certainly more physically powerful of healing. It shows up often as a very masculine presence, although it said it's both mother and father at different times, depending on what is called for. And it is a root. And what's interesting about the root is its work. It takes us into the root of ourselves. It takes us into the root of our traumas, the root of what needs to be healed. That's why it's so good for addiction in addition to detox. It takes us to the very root of why we're doing these things in the first place, to help understand them. And then when we understand them, then we know how to heal them. So it's a very wise medicine. Yes, go ahead.
According to my spiritual father, Binana, Papa Binana, who has taught me the ways of the tradition, he explains it like this: all plants on this earth, all trees, all plants, everything on this earth, plant-wise, is medicine. So hence, when it comes to a traditional story with the medicine, that the earth was once a barren planet, and Iboga was planted. Iboga was planted by the grand architect, and that plant Iboga was intermingling with the earth, the earth, the soil of the earth, and everything, and then on the earth beaker and creating with the sun and the moon and the winds and the elements and everything, and decided to create mycelium, psilocybin, and the psilocybin ended up melding and molding with the Iboga medicine, the roots, and absorbed some of that medicine within the psilocybin, and then spread across the entire planet through Iboga, and created all these plants and everything that you see on this earth, and hence the fact that the reason why there's medicine everywhere. Even within other plant medicines, it actually makes logical sense. Yeah, and this, of course, this all started with Pangea, and then when everything broke apart and all the continents spread out, and they went into their own environmental sectors of the planet, the environment evolved and changed over time, and evolved these medicines into what they are now, which brings the standpoint that Iboga was the first medicine that started all medicines. So,
Bessie.
Yeah.
The progenitor.
Yeah, and then even originating the original doctors and the original scientists, that started working with these medicines and started healing people with these medicines from the earth. Evolution just advanced and evolved to the doctors and the scientists of what we have today. Through the original doctors and scientists. So it's all the progression. Everything's just a progression. And that is technically the evolution of Iboga and evolution of medicine in general, and it makes logical sense if somebody wants to speak about it in technical terms. It does. But if people are going to understand it or believe it or trust it, that's up to them.
See for yourself.
You're gonna have to see for yourself and find out for yourself by working with this medicine.
And I think that's a really interesting concept because, we know that these psychedelics, we're talking in technical terms, touch receptors in the brain and touch experiences that we just don't quite understand, right? I mean, in the world of psychiatry, we have like one medicine that we believe can touch an NMDA receptor, which does other things. And so we've always kind of lend ourselves to these medicines that made more sense because we could see it better, right? But it's kind of interesting that the more that we see, or maybe the easier that we see it, the less effect we have with it. And so it's something that there's this really powerful root, and through this root have came other, plants and other medicinal properties that we still really can't see very well. But they all kind of seem to have these experiences of healing. So when you think about it from the perspective of when this became a medicine, was there something happening in these tribes, like traditionally, where they were like, we need to use this at this time? Or was this something that they found and had this like spiritual experience? How does it become part of their rhythm?
Do you want me to share
early
the
on?
origin story, or do you want to?
No, you don't need to share that. No. How does it
Become part of the toolbox.
Become a part of the tradition? How did it become a part of the tradition? So they discovered it. They discovered it. The Bobongo, the Pygmies discovered it, and through an animal, so to say, the porcupine. But there's many different origin stories. That's just one origin story out of many. And this is the one that's known that has been let known to the Westerners. It's a porcupine story. So, and when they discovered it, they realized that this medicine or this plant definitely can take them beyond reality, take them to true reality. Especially within the spirit world.
So clarity.
Yeah. Even more than clarity. It shaped and formed their minds to the point where they were able to shape and form their traditions. And they even took it beyond that by expanding with certain protections from a spiritual aspect, because there are a lot of dark things out there in this insane asylum we call Earth. Yeah. So
Spirit world's like a jungle.
yeah. So and they seen it way back when.
Yeah.
They seen it way back when. They were able to see the future way back when, and decided to stay in the jungle. Decided to stay in the jungle, and to keep practicing their traditions. But the people, there were other tribes that were outside of the jungle, big tribes, that ended up going into the jungle to learn these traditions. And so that's how the tribes were introduced to the traditions, and shaped and formed their traditions through this medicine, and they were able to bring it out into the world. Yeah. And so once they were able to bring it out into the world, it just it's like domino effect. It just expanded. It just kept expanding. Yeah. But they actually kept it secret and shut it off to the West, because of all types of things that they've done, especially coming in and taking people, stealing people, and all types, and even their own people being involved in that. So they had to keep a lot of this stuff secret until the medicine decided to really open it up to the world. So this is the medicine's decision. The medicine makes all the decisions. Yeah. So the tradition and the Bwitiists decided to listen to the medicine, and okay, we're going to open this up to the world. And so now Westerners are coming in, very, very little, but they're coming in. And it's just going to evolve from here and just get bigger from here on out.
And you guys kind of mentioned before just the people who have came and experienced this medicine and had healing. And so it's as if, it started with this experience, from the tribal perspective, and then now we've kind of taken it and started to use it as a medicine. You mentioned trauma earlier, and I know the study that just came out 3 weeks ago out of Stanford, where it was really highlighting not only PTSD, but traumatic brain injury with PTSD. And just the first time I'd ever heard of this was actually from a professor I had 12 years ago, who was talking about herb that was in Mexico and other areas that people were going to and kind of getting what they called a reset off drugs. And so the opiate stuff too. So before we jump into opiates, what is it about trauma and this herb that's so healing?
I love this question. Thank you. This is also the ultimate medicine for trauma. And what's really interesting is that we have a lot of people come here who have done work with other medicines. And they get here, and then they say, I thought I was over that thing. And what this medicine does is it scrapes to the very bottom of every residual stone that has been left behind from experiences where we disassociated. A little or a lot. That's what disassociation is. In a shamanic sense, we view it as the soul ejecting itself from a situation that it does not have the tools to handle at that point. But it must be seen at another point, because the only way out is through. So it saves it until a point when we're in a safe container where we have the capacity and the tools and the support to actually process it. And everything needs to be seen and felt in order to be healed and released. So it goes into the psychic basement, it goes into the psychic attic, and goes through every box, and it will show you everything that's in your psyche at 1,000 miles an hour often. So we call it a mind purge. Purge. Everything. And it will dredge up things that have not been fully felt. And people will find themselves in, a mental purge, an emotional purge. And we're by their side. We're midwives, essentially, supporters, helping them to heal themselves as they find their truth through that process. And also, this is a medicine that really unravels mental narratives that aren't 100% true. A lot of people have inherited limiting beliefs and narratives. Often for many people, it's on repeat, on loops of like, oh, you're a loser, or oh, this will never work, or oh, prepare to be disappointed again, or whatever the message is. Some people really masturbate resentments, or
we call it mental masturbation.
Yes,
I actually done an episode on mental masturbation. Yeah,
people cling to their pain through these narratives.
They're addicted to it.
It's an addiction. Even despair is an addiction that keeps people safe from risk. From exposing themselves, from being disappointed, from trying, from intimacy, right? So it will dredge up all these mental narratives that are not 100% true, and it will expose them for what they are. And then people have an opportunity to put it down. And we see a tremendous rebirth for people with their participation, their full participation. We just stay present, and it's a beautiful thing to watch people's souls shining through without the weight. You know, it's like people putting boulders down that they've been carrying around in their backpack, sometimes generational. You talked about generational, right? Generational stones, generational narratives. Doubt is a huge one. Being super critical of yourself, which is internalized voices of our ancestors trying to make us the best we can be, right? And the truth will be revealed. Do you want to share on that too, on trauma?
Well, I think you said it best, but yeah, we have a lot of people coming in here for trauma and traumatic experiences, and we do our best to, like I said, help them help themselves when it comes to them participating in the ultimate healing that they need for their mind, body, and soul. So they definitely have to do work. You know, and this type of work is getting like 30 years of therapy in less than 24 hours. And it's almost like this. This is how I describe this type of experience. It's almost like, you know how you have to fight a virus with a virus. Okay, this is almost like having to fight a trauma with the trauma. So it's almost like a traumatic experience with this medicine, but I'll say a positive traumatic experience that you have to fight negative traumatic experiences with positive traumatic experience. With the positive traumatic experience, you need something that impactful to break all those impacts on your brain, on your mind, body, and soul. So you need something this strong in order to break those chains, to free yourself from it. That's one of the best ways to describe this medicine. That's why there's such a fear put out there about it, because it's so real, and it's just you're basically just seeing the truth about who you are and what you've done in your life, and what are you going to do about it?
What are you going
to do about it? And you're able to ask these questions about these traumatic experiences and receive answers that will help you navigate the rest of your life from here on out.
Man, it's so powerful.
Yeah, no, it's really powerful.
I'll say one other thing about trauma.
Yeah.
Can I?
Yeah.
So the other piece about this is ancestral healing. So a lot of people, there's a lot of trauma there that we carry all of our ancestors' memories in our body.
Oh yeah, in your mind.
And I think so many cultures believe this, right? It's not just like one culture believes that. Like I think that's pretty consistent across the board. Is
Very
you are
much.
carrying the experiences of the people behind you. You're going to impact the people in front of you. It's just this generational experience of trauma. Yeah, absolutely.
Yeah, and also studying our ancestors' strengths, which can be expressed in many ways, sometimes positive or negative ways.
This is what we teach here.
What's so fascinating too about studying the animals is that elephants also eat iboga. And unfortunately, please don't buy this on the dark web because it might be from an elephant poacher. They follow the elephants. You need to know where you're getting your medicine, everybody, also so it's not adulterated. But the elephants take their young ones on long journeys to fondle the bones of their ancestors. That is no coincidence. These beings eat iboga. They have incredible memories. They have a connection to their ancestors, and it allows human beings to do the same. We must fondle the bones of our ancestors and understand who they were and why they developed certain patterns like being hypercritical, certain patterns like a work to death ethic is very common sometimes in like people who've had like immigrants in their ancestry that have faced scarcity, to study our ancestors' bones and understand what made them develop these patterns, and that allows us to put them down in this life when they're no longer helpful. And they want us to dance free. They want us to dance light. And in the spirit world, so one thing you won't get in Ibogaine is this very, very traditional guided journey through what we understand as the spirit world, which is a place and not a simple hallucination. You know, people can see in different ways, but it is actually a realm that we visit, and we help people to communicate with their ancestors in real time. And they ask their deepest, most heartfelt existential questions with the help of the medicine, and who they're really talking to is like their soul and the universe. But people get very, very clear answers when they're in the right weather conditions, let's say, of the journey. So in that way, people can actually go in, and someone like Chor or myself can help people to heal their whole ancestral line in the spirit world. So that's a big part of the trauma healing.
Oh yeah, and elephants eat Iboga. That's how it helps them make babies.
It's true. You don't know. It's an aphrodisiac, actually, when you get past the detox.
It actually is. Yeah.
Because Iboga loves life.
Another thing that I was going to mention about ancestral trauma or ancestors is that your mind has a mind of its own, and that mind has a mind of its own, and that mind before that, and that mind before that, which is your actual ancestral bloodline, leading all the way back to your first ancestor, the first ancestor that created your entire ancestral bloodline, your family, everything before that. So everything that they went through, trauma, everything that they've seen, everything that they've been through in their life is inside their mind. And that got transferred to the next person in your bloodline. All the way up to you, like a domino effect. That's a long bloodline. That's a long bloodline of ancestral trauma and technically everything that they've seen passed all the way down that line to you. And so we have to go in and help clear all that. And that's a lot of work, and that's a long line of ancestral healing.
Well, I mean, I think you're even talking about something that's such a hot topic in Western, or in all psychiatry and all medicine, is like, you know, through the human genome and this all the understanding of genetics, we get really focused on DNA and anatomy and all these other concepts. But what you're talking about is it's much more than just these small molecules and atoms. You're talking about these are spiritual experiences from way back when that you can just see the coding.
Exactly.
And just because we can see it don't mean we can fix it. But we can see it. What you're saying is this is how you fix it.
This is how
it's through not having a hallucination.
To fix it. Yes, there's a process to fix it. Through the visionary experience. Yes, that is a part of it. But you can, even without the visionary experience, you can still have aspects of healing your mind, body, and soul.
Well, and I think that's what you mentioned earlier of the people who come here are in a place where they've been doing the work, right? This isn't someone who woke up like yesterday and was like, man, I feel kind of depressed. I think I want to go do this in Costa Rica. These are, maybe, but for many people, this is, years and years of therapy. This is numerous antidepressants or mood stabilizers, maybe hospitalizations or maybe even forced hospitalizations and all these experiences. And I pointed to my left, my beautiful wife is here with me, and she'd mentioned, as we were talking, that's kind of one of the biggest challenges in Western culture. Sometimes we don't want to do the work. And so that can be very hard to kind of say like, hey, you know what, this is a medicine I'm going to give you, but you're going to have to do work with it. You're not going to take it and make you feel better.
I love this. Thank you for bringing this up. And we work with a whole variety of people. And just in the last retreat, we had people come who purged the spirit of suicidality. And who were told by mental health practitioners that they would probably never be without certain pathologies, and that's really unfortunate because they haven't met Iboga, and they did such beautiful work here, but they faced themselves. And often we see people who have been on a path of healing, whether it's through mental health, whether it's through plant medicine, Vision Quest, even the people who come here drawn to help heal the roots of people like in long-term recovery, because we don't do acute detox here. That's not our calling. We do work with people with very sophisticated preliminary detox coaches to help them to prepare, because what we see is the cleaner people come to this medicine, the more benefit they get, the more treasures they get that actually keep them well, because it's not getting detox that keeps somebody well. It's not getting sober, like it's detox from drugs. It's not getting detoxed or sober that keeps people well. It's actually connecting with their soul and becoming inspired, and that they become very clear on what they need to do with their life and what is the even the purpose of life. When you know the purpose of your life, that helps you to stay well. And I like that word better than sober, to stay well, right? So we work with people in a very careful way to prepare them so that they can get more out of this experience. We're not interested in the factory profit. We're interested in people coming in a good way so that they get what's worth our time to give, you know, which is the greatest possible blessing. And that's how we work with people. And God bless the Ibogaine clinics that are taking people who are just in a way, you know? And that for some people is a good first step, actually. And actually, one of our greatest sources of referrals is Ibogaine, because people will have this experience in Ibogaine and they're like, I feel the Bwiti calling me. It's like, great, come over here.
Well, and I think you bring up kind of what we think of when we think of Iboga, right? Is the people who are having these detoxifying experiences. And that's kind of my understanding, that's what it was, right? But it's much more than that from what you guys have talked about. And that's just the first step of it. But before we jump into that, I wanted to kind of throw, especially for like the listener, I think a lot of times we think of like detoxing and detoxing substances is really just like opiates, meth, alcohol. But I kind of hear this, and the more research I've done on this is it's any kind of substance, right? It's eating really terrible stuff all day long. It's watching pornography all day long. It's any kind of vice that has got a hold on your life or your soul or your spirit. That's the detoxifying process that you have.
And the number one and the most dangerous critical addiction is the mind and the loops of the mind and the, you know, catastrophizing disaster baiters out there.
Yeah, absolutely. Yeah.
You know, these are addictions. And this medicine, one of the greatest gifts of this detox of mind, body, and soul, and it's the mind that causes the other addictions, right, is the ability to be more fully in the present moment. And that is bliss. And if we're in our mental loops all the time, we're actually not in the present moment. Those mental loops have nothing to do with the present moment, but they exhaust us. And then we don't have the energetic resources and attention we need to actually deal with the present moment in an appropriate way. So I love that this medicine brings us into a very, very deep presence, a full body presence, not just an intellectual presence. I love that.
Yeah, the mind.
Worst addiction.
That's where it all stems from. There's more than just substance when it comes to addiction.
Well, you know, we say it a lot with the work that we do, because I have a clinic where we do a lot of medication-assisted treatment in the opioid world, and that's kind of the tool that we have right now, and so that's the tool that we use. But one of the things that we talk about is that ultimately, no matter what you're doing, it's just a behavior. You know, so you know, whether you're eating chocolate cake all day long, you're cheating on your spouse all day long, you're using heroin all day long, it's all the same. It's just there's something going on deeper. And what you're saying is this is the kind of the key to the deeper, to the point. But you got to be willing to do that work.
And
to face ourselves.
Face yourself and work on your mind. Work on your mind, and that's what's so important about this medicine, because it's a mind medicine. And if we make that conscious decision to really face ourselves and really decide to work on our minds, we can focus on not being mind hoarders and hoarding all this information overload in our minds, to where all it's going to do is just going to send us down a path of a ball of confusion, you know. And you need, that's why there's a reason for everything. That's why there's a reason why this medicine exists, is because, and it's coming out more now, is because it's to help people help themselves heal their minds. Yeah.
Help people help themselves.
The human being mind is the root of all of our ecological crisis.
It's
and wars.
Issues going on.
Well, and you mentioned that, for some people, they have like this experience, and so now you've had this detoxifying experience and what we know of the purging. What's going on after that? Because I think that's something that we just don't talk a lot about. So you have this purging experience, so then what happens?
After the purging experience. So after the purging experience is more of your integrative experience. So you're gonna have an integrative experience, especially working with this medicine. So when say like after you have your first session, right? Some people some people can be in a confusional state, but they're feeling good. But at the same time, they're realizing that all this purge and all this mental purges, all this stuff is coming up for a reason, or they don't even realize it, and we have to explain it to them. And so there's definitely a process of guiding people or helping people navigate these purges and these experiences, because if they don't, they're not going to realize what they're going through. And that's why it's important for them to for one, or the provider or the teacher, to explain this type of stuff to them, because if they don't, they're gonna be confused, and they're gonna be lost, and they're gonna have to try to figure it out on their own, and you just can't let anybody do that when it comes to the integrative process.
Yeah, so I'm hearing that not only is it this cleansing experience, but there's an integration, and you're doing it with under the supervision of someone, right? So this isn't like you hanging out in your bedroom all day long, and then like you get hold of it, you throw up for a
People
little while,
wind up in the emergency room like that, or wander in the street confused.
Yeah, absolutely.
Don't do it.
Got it. Okay. Yeah.
And that's why places like this exist.
Yeah. Because I think that's the biggest fear that we talk a lot about, is that, I think, I've mentioned it to both of you as we were talking, that's kind of what's happened with ketamine. Right, is that ketamine has been helpful for treatment-resistant depression in some cases. However, you can get it shipped to your house now, and you just take it right there in your bedroom.
Don't get me started.
And then I think that's been probably the biggest transition we're seeing in the discussion of psychedelics. There's a huge conference that occurred, I want to say it was last summer, out in Colorado. And Colorado is a state in America that's really pushing this. And a lot of the traditional healers were there, kind of saying, you're not talking to us. You're not referencing us. This isn't something you're just going to do hanging out in your house. And it caused quite the uproar. But I'm hearing that after this detoxifying process, that's where the big healing happens with integration.
Let's talk about that. Thank you so much for bringing that up. And ketamine, we're in a very, very problematic crossroads with ketamine. That's another conversation.
They use it because it's a part of the medical model.
Yeah.
And that's the only reason why they use it.
Yeah, and very, very toxic.
The medical model is something that they can understand.
And a lot of permission around psychedelics right now, and a lot of, there's people who are in kidney dialysis or in permanent erectile dysfunction from ketamine. Just look at the studies, it's really, really sad. We get people all the time who are terribly addicted because of this permissive environment. It's like, oh, it's good for you. No, it's not. I mean, I would never recommend it for anyone who's been through hard addiction. I see its therapeutic benefit in certain extreme cases. But that's another conversation, is really looking at how is a medicine made? What is the intentions with which it is made? And the containers. But going back to the purge and what comes after the purge, and I see that, it's walking through the fire. The purge, it dredges all these things up to be felt, to be seen, because the only way we can release psychic material that's holding us back is if we really know what we are releasing. We can't release something that we don't know. It's like going through your basement boxes. You're not going to give everything to Goodwill. You have to go through every one, because there might be heirlooms in there that you want to keep. So there's this complete inventory, excavation, spiritual archaeology. And then, so Iboga is half destruction in that way. of seeing things, letting them go. And we help people to let things go through a shamanic process with like breath. And it's a very beautiful process. And then half of Iboga is creation, and it must be. We are sitting with these minds that, although they are very problematic, they are also divine instruments of visionary creativity and communication with the cosmos beyond the intellect. We're talking about mainlining the archives of wisdom that are available free for download, and universal codes of beauty and love. So we must come into the creative side, and this is what we see between the two ceremonies, which are very important here, not just one. Half destruction, half creation, and it's then we focus a lot on the creation on the second ceremony. What do you want to create? Because with those 80,000 thoughts a day, I mean, it doesn't even stop when you're sleeping and dreaming at night. This is such a powerful creative tool, is that we just must decide what we are creating. And to anyone out there who's suffering from addiction and suffering from mental loops, I want to say this, that addiction, the power of addiction, it's so compelling. It's so binding. It's so strong. It's such a drive, right? And the mental loops, the mental suffering, it's an impulse that like we keep going back to the same things. At its core, those are your powers. That's your power. And we must decide what we want to be addicted to. Chor calls it a positive addiction. I say we must choose in every moment. What are we devoted to? Devotion is the power of addiction. Addiction is unconscious and compulsive devotion. Devotion is conscious and intentional addiction. They are two sides of the same coin. So half destruction and then entering into creation. I love this part of the work, to help people understand what they want to create with their power and to harness their full power and not be ashamed of their power. Iboga said the only way to heal an impulse is to make a new impulse. So we must choose our impulses wisely.
Well, and I think you bring up a really good point in all of this, is that so much in how we treat addiction today is we just remove the substance, right? So just stop using this. And I talk about people, let's just stop. And even like, and I think it's because we haven't quite understood it well. I mean, even when you look at AA and NA, they still put something else in its place. It's only like us, I think, in certain worlds that we're like, well, let's just remove it, and then let's talk about all the things that make you want to use, and then you hope you don't use again. But you're saying that there's like an integration that must occur to where you're now deciding to move forward, and I think that lends to, there's a discussion of, talking about powers. I mean, people who are in active addiction, especially people who are just kind of prone to certain behaviors, they would have been prized people in other cultures, right? Like these were your hunter-gatherers. These were the people who would take those risks. They were the adventurers. They were the adrenaline seekers.
And deeply feeling people.
Yeah, and feeling. And they understand the intricacies of the tribe. But it's just unfortunate because in maybe our current culture, their skills just aren't being used in the right way. And so then it gets diluted down with that substance. Yeah. Okay.
Yeah. Definitely in the business of helping people help themselves, like really truly love themselves, genuinely spiritually love themselves, to the point where it's a motivation to where they are truly listening to themselves. Aside from having to listen to somebody externally, they're truly listening to themselves internally. This is the business that we're in when it comes to working with this medicine, because that's the purpose of this medicine, is to help people listen to themselves truly, efficiently, and spiritually.
And that
mentally, physically, emotionally, all that good stuff.
That is the ultimate form of decolonizing. Is to actually listen to ourselves first.
Yes.
And that's ultimately, that's what healing is, right? It's just this ability.
The root of all healing.
But it takes a lot of work, and it takes guided people, and it takes all of these other experiences.
It does.
And I also see, what's not talked about in some of the programs out there for addiction recovery is that when addiction comes, it comes for a reason. People are so focused on just stop it, just crush it, but not asking, why did it come? And what is the true medicine that I need? asking what is the true medicine that I need. Maybe it's meditation. And community is so overlooked. Like you were talking about community. Statistically, community is one of the greatest things for our mental and physical health and life span. Statistically, you know, and that's why these medicines are held in tribes. And that's really overlooked a lot.
Which, you know, I think that's really important too. I work in a very rural area in northern Florida, and I see a lot of people get sober in like echo chambers, right? So it's just them in this small little area. They have no community. They'll come see me like, you know, once every couple of weeks, once a month, whatever that looks like. And that's all they have, right? And so then what'll happen is as soon as things go awry, as soon as things get bad, they go right back to it again because that was the only friend they had. That was the only community that they had. Yeah. And so you're talking about that, you know, part of this integration is more of just, it's more than just things happening inside your head. There's also things that's got to happen outside of you.
Oh yeah, you definitely got to make changes for sure.
Oh
you know.
yeah, well truly,
that's the thing here is when it comes to the balanced perspective, the balanced perspective to everything, you know, and people really understanding that, and understanding what that really means. So when it comes to the balanced perspective, it's like, okay, how am I going to develop a relationship with this balance? How am I going to respect both sides of this balance? So when it boils down to everything, when it comes to the balance, we have to learn how to develop a relationship with both sides of ourselves. And respect both sides of ourselves, because you don't if you don't pay attention to one side, the other side's gonna catch feelings, and then it's gonna conjure up in you, and then it's gonna start acting out, and that's what helps people or pushes people to feed into their addiction or to feed into those thoughts. So if they realize that they have to acknowledge it, not saying they have to interact with it, they have to acknowledge it, it shows a form of respect to that side. And you're developing a relationship with that side to the point where that voice inside your head is going to start becoming a little bit more minute and start pushing itself to the background because you're respecting it. And you know it's there, you realize it's there, but you're able to navigate, and you're able to show it some love, and you're able to respect it. You're able to develop a relationship with it to the point where that voice is even gone.
So it's not an avoidance. It's not just this impulse. This just because you see that a lot, right? It's just
you gotta understand that it's there. You got to realize that it's there and know that it's there. It's not going away. It will never go away. You just got to acknowledge it and respect it and trust it. Yeah.
I see. I wanted to add one more piece to the integrative part of what comes after the purge. And that is truly that, you know, when people come to Iboga, it is a powerful rebirth. And it is this potent combination of mind detoxification along with body detoxification and the neurogenesis. People have a radical upgrade in their nervous system, and I see it right before my eyes, you know, that people are growing new neural networks, making new connections. And when they come out of Iboga, what they have is like, okay, they're not a happy robot. They have to practice. Iboga doesn't, you know, we don't value anything that we get for free.
Right?
Iboga wants us to have an evolution of consciousness, not to be, you know, a happy robot, like a lot of medications. Well, on the surface, they seem to do that while there's still shit in the basement. But Iboga, the people come out and they have seeds. It's a beginning. And what do you do with seeds? If you know, what happens if you put seeds in a drawer and never look at them? Iboga will give you what attention you give to the answers you receive, to the practice that you give. I had to practice 100 times a day at first. Now, I have a whole different relationship with my mind. My mind does not bother me ever. I am really in a good way with my mind, and I'm so grateful for that, even in really difficult circumstances. So we get seeds, and there's a lot of creative ways that we can nurture those seeds. And I also really pray, I want to put out a prayer there. I hope the modern psychedelic renaissance defers to and apprentices itself to the indigenous wisdom carriers, because it's not just the patented substance that's going to make people well. It's the community. It's the relationships that hold the medicine. It's the attention that we give to the seeds. It's the devotion. And most of all, a reciprocal relationship that we are giving and receiving, because that, it's not just the medicine, it's the way we come to the medicine is the very answer to our prayers for healing that we seek. And the indigenous people know how to come to medicine. And we need to learn that, not just take it, go to their therapist's office and expect to be, be a happy robot. It don't work like that.
Yes, so you bring up a great point, is that there's this need for, wherever you're at, right? Whether you're in Western culture, or whether we're in Europe or in Australia, as we're having this huge movement right now, the need to bring in all these traditional healers, have that kind of knowledge passed on, use them as guidance, have this integration concept, be able to use people to help guide people in the integration. You're not doing this in your basement, hanging out, that kind of stuff. I know that there are...
it gets weird like that.
Yeah, I would imagine. I definitely would imagine. So, just from what I've heard. But one of the things, there are some risks with it, right? And so how do you mitigate some of these risks? Like, what do you guys do as a team to look at that? I know the QT interval is a big one that's always talked about. There's always a risk of, what we call schizophrenia in our world, or a psychotic experience. Like, how do you guys mitigate some of that?
We have medical professionals that we work with that have many years of experience with this medicine, up to 15 years of experience with this medicine, and they make sure that we are safe, that the person that is coming in for the healing is safe. We got to make sure that the container is safe, mentally, physically, spiritually.
Do you think that's something that was also being done traditionally, or that's needed now because of just the world that we live in today?
Traditionally, they are the medical professionals. They are the true medical professionals. So there's a different context, between Westworld and where they're from. They don't have the many mental issues that we have, or physical, but they're still medical professionals, and there's a whole room of them. So they're able to see, pretty much everything that's coming through those doors.
Okay. Yeah. Absolutely.
Yeah.
Yeah, thank you for bringing up safety. This is really important, especially with this medicine, because I'll meet people at conferences and they're like, "Where can I get it on my own? I can do it. I'm an experienced psychonaut." It's like, not with this medicine. So there's physical safety and psychological safety, and so we go through a very, very careful screening with people. They go through a whole thorough medical questionnaire and psychiatric screening with an intake nurse who consults with our doctor. Our intake nurse has been to Africa 3 times, Bodhi Chapman. He's marvelous, and he brings all of his Bwiti spidey senses into that consult. And also our doctor, Dr. Douglas Rosales, is amazing. He's treated over 2,000 people safely over 15 years. And he has a very personal relationship with the medicine and a background in psychology. So we have this very careful medical psychiatric screening, because it's not appropriate for everybody. And if people have a history of non-drug induced or sleep deprivation induced schizophrenia, which, it's different if someone's been on crack for 5 days or something, anyone will be schizophrenic. But if they have naturally occurring schizophrenia symptoms or psychosis, what I see is those people don't need medicine because they already are medicine, and they need shamanic mentorship and ceremony medicine. And there's a lot there. There's a beautiful article by Mali Domasome that we talked about, maybe you can link to in the show notes. What a shaman sees in a mental ward, like those people, they just don't need it, And so we make sure that medicine is appropriate. And then we look at, in the medical screening, we do a 12-lead EKG and blood work with a kidney panel, liver panel. We check electrolytes, anemia, iron levels, and also for optimizing their experience as well as safety. And sometimes people will have something that shows up on an EKG that they otherwise think they're completely healthy, that it's no problem, but this little thing is just not appropriate for something that prolongs the QT. Or people will be taking an herb or a medicine, or, kratom is very contraindicated because it prolongs the QT. Passion flower, St. John's wort, affects serotonin and all these things. So we need to make sure. There's a whole laundry list of medications, herbs, and supplements. And we do see in the West here loads of medical issues that they never see in Africa. And that said, like he said, they are the doctors. And what's so fascinating is, for example, here, Ibogaine centers will use atropine to regulate heart rate if they need to. The indigenous people figured out how to do that with belladonna, which is the root of atropine. That's a plant that atropine will be extracted from. They're very sophisticated. And Chor and I are not at that level yet that we're using belladonna or sniffing things out in the jungle that can help. We have our doctor here with emergency medications, you know? Absolutely. Yeah. So we're meeting two worlds.
Oh, but I'm training too.
Oh, but he's training. You know, he's That's training incredible. for all of that. Yeah. And additionally, so the doctor will be on site the entire time that the medicine is active. It's not enough to have a good screening. And I want to put this out there to all the people who, you know, I hear about people who are holding this medicine that have no business holding this medicine. They need a medical professional who's present the entire time the medicine is active, even until, if they're working with Iboga, up to 2 days later.
2 days, wow.
Yeah, it's a 72-hour medicine. People can go in very deep states. People can have open eye visuals 2 nights after ceremony, 2 full nights after ceremony. So having that person on site is important. Having 24/7 care is important. Even when people seem grounded, they can still go into these deep states. And a medical professional who understands the medicine and all the contraindications. Because someone who didn't know better might give him an anti-nausea medication that would cause a heart issue. And we need to really know the medicine. And in addition to that, there's spiritual safety, which Chor here is ordained at a very high level within the Bwiti for spiritual protection, because the truth is that these medicines open us up to a jungle of an unseen world. All kinds of spiritual parasites swimming around out there, and all kinds of benevolent spirits that we can interact with too. And he carries a very important lineage of deep knowledge of spiritual protection and how to navigate those things. Not everything people encounter in the spirit world is good for them. So spiritual safety and psychological safety of having an awareness of trauma and how it works, and responding with really compassion, groundedness, and never taking anything personally. Right? This is really key. So all of those things, being trauma informed, is very important, but also an awareness of the spiritual reality that this medicine opens us up to.
That's powerful. Yeah. Yeah. Would you think about it from the perspective of, let's say I have somebody out like listening today, it's like a provider, they're looking to get involved in this. How would they go about learning more about this as a medical professional?
Well, we got a bunch who are students.
Okay.
Yeah. No, we train people here.
We love medical professionals.
Yeah. Okay. Yeah. No, we definitely train people here in with this practice, so they can be well-rounded and well-educated. But at the end of the day, they're eventually going to have to end up in Africa and go and walk in the path. See, one technically or definitely has to do this medicine. And then once they do this medicine and they experience this medicine, it's either going to call them or it's not. And they're going to be walking the path, and they'll be ending up in Africa, doing the initiations and rite of passages and stuff, and learning here and taking it the distance. Yeah.
But what I hear is that there's actually a desire for that collaboration, which is big, because we find ourselves that sometimes in the medical world, be like, oh no, that's just kind of, alternative medicine. That's not really what we do. But there's a need for that combining of the two forces.
Yes, absolutely.
The other way around.
Yeah.
I see that there's many blessings to bridging worlds. And I love medical professionals because this medicine completely ignites their medical intuition. Also, I mean, that's what the indigenous people use it for. This is their X-ray, this is their diagnosis, this is their prescription, this is how they source what people need to heal. We started to learn some of that in Africa, which is fascinating, where you look inside of someone's body. So it really, all that medical knowledge is very useful, but ultimately the path forward to being involved with this medicine or serving this medicine or helping people to integrate from this medicine, it comes from an invitation from the medicine. And we source that here when they come for their experiences. That's where they receive the invitation to Africa. And there's specific things that we do, and receive the invitation to be on the path to serve the medicine. And even being on the path to serve the medicine is a profound path, whether or not people ever serve it. It's the deepest path of personal growth I've ever experienced in all my 30 years of ceremony and yoga and meditation and therapy and other medicines. So it comes from the medicine. It's an invitation, and we look for that.
That's beautiful. Yeah. So I know you guys have a lot going on. I don't want to take too much more of your time, but for anyone out there who's listening and they're struggling, right? Like I know you mentioned earlier, you talked about the addiction concept, but just you find yourself feeling very depressed, you're very down, or you're very anxious, or you're just kind of in this world of the mental loops. Yeah. What's something that you recommend they do now, right? Like what can they do to get like some relief right now?
I love this. I love this question. Thank you for this question. And to all of those people, just sharing with you my love, all of the pain, the suffering, the depression, the anxiety. Actually, when you trace it down to its roots, it's a desire to love and mourning the loss of love. And there's love there. If we sink to the very bottom, is love. And tracing it all the way down to the roots. Giving yourself love. And self-love is a verb. It's not an idea. It is giving yourself love, spending time with yourself, listening to yourself, and trusting yourself. And there's only one way, actually, that people are like, try to wait to be perfect in order to trust themselves. No, trust yourself first. It takes practice. Start somewhere. And everyone right now can take a deep breath and breathe in the spirit of trust. Trust has a very specific spirit, and you can breathe it into your whole body and inquire, what does trust feel like in your breath? What does trust feel like in your heart space? What does trust feel like in your belly? What does trust feel like in your bones and in the blood flowing through your body? And in this way, we invite the spirit of trust. You can invite the spirit of love. You can invite the spirit of forgiveness, because all of these things are not intellectual states. They are full body experiences. So in this way, beginning with self-love, listening very, very deeply, because the truth is every person has their own answers. Every person is their own guru, but they stopped being able to listen. The more you listen to yourself, the clearer that voice gets. So start somewhere.
So listen.
Yeah. Listen. Listen to yourself. And it may take some patience if you haven't been listening in a long time, because that friend inside, that soul is like, fuck you. You ain't been listening to me. Be patient. Leave flowers at the doorstep. Be in open inquiry. Keep listening. Do nice things for yourself. And you will find the way. And also, thank you for being a feeling person. It's not easy to be a feeling person in this world today. But we need feeling people. We must, and this is the agreement that I have with this medicine that helps seers. This is a seer's medicine. We must be willing to see all the pain and feel all the pain in order to best respond to it. And that is a sacred agreement that we make in service. And also to look at all of life as a rite of passage. Not get out of the why me or why not me, why me, why me. Make medicine out of everything. Everything is a rite of passage. Everything is initiation. I hate it when people say everything happens for a reason, because that's half the story. Everything happens for a reason if we make a reason. Make a reason.
Absolutely. Thank you.
Anything you want to add? Chairs on top?
What was the question again?
Words of advice for people suffering out there.
Words of advice for people that are suffering. Elizabeth said it best. Trust yourself, but trust yourself in order to look and see who you really are, so you can face yourself in the mirror, and get to that point where you can tell yourself that I love my life. You can tell yourself that you love your life by looking at yourself in the mirror. But if they're gonna get to a point to where they want to prepare themselves for walking this path, or at least exposing themselves to the ultimate healing, they like I said earlier, this medicine isn't for everybody.
Mm-hmm.
This medicine isn't for everybody. This way isn't for everybody. Not everybody's gonna make it. You know, they're gonna make their choices. They're gonna make their own decisions to go down their own paths.
Choice.
You know, if they truly listen to themselves, even if they don't listen to themselves and they listen to somebody else, they're still going to make a choice and go down some path, some rabbit hole, you know. But at the end of the day, they need to dig themselves out of them rabbit holes. They need to dig themselves out to really, 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 really trust themselves, love themselves to the point where they know they need help. They know they need it. They need to acknowledge it. They need to accept it, the fact that I need some help, and they need to come to that agreement with themselves first, and that's pretty much what it is, an agreement. Making an agreement with yourself that, okay, do I need healing or not?
Yeah.
Do I need to take do I need to at least achieve a certain amount of healing? Like I said earlier, does everybody really heal? Do they? Do they really heal? They can heal to a certain extent. They can heal as much as they need or feel they need healing. They can heal to the best of their ability.
To the extent that they're willing to be uncomfortable.
To the best of their ability. They can heal to the best of their ability. You know, and they can always do their best at working to heal themselves. Maybe healing is not the proper term. Maybe it's just like loving themselves is the healing term. Learning how to love themselves is the healing term. So
thank you guys for that. Thank you so much for the knowledge and the wisdom and the conversation. For anybody that wants to follow your all's work, like how can they connect with you all and the work you're doing here?
Sure. soulcentro.com. That's SOULCENTRO.com. Yeah, and there's a retreats page there. You can learn about our retreats. There's photos of Africa, get a glimpse of the roots there. We are on Instagram at soulcentro_retreats and on Facebook at Soul Centro Retreats, all one phrase. Chor, and you can see some of his Iboga inspired art at chorboogie.com, CHORBOOGIE.com, and on Instagram at Nyangu. It's GNYANGOU. Had to look at the tattoo on your neck for that. And I am also on Instagram at Bast, and we love sharing medicine. That's what those platforms are for us, and love connecting with people there.
Guys, thank you so much. So grateful.
Thank you so much.
Basi.